that usually develops when the heart cells, they're not receiving enough oxygenated blood. Okay. So are you familiar with the word ischemia?
I heard it, but I just don't know on top of my head.
Make sure you know that ischemia means lack of oxygen at the tissues.
Give me a second.
Don't worry.
Amara pati ang koro, please. Genius.
Yeah, I can hear you.
Yeah. It's decreased oxygens in the tissue?
Yeah, so yeah. You know how we breathe is because we bring in oxygen, and our red blood cells, what they do is they carry oxygen. So that oxygen that we breathe in, our red blood cells picks it up in the form of something called hemoglobin. Do you remember the word hemoglobin?
Yeah.
So the hemoglobin, yeah, is a protein that is attached to the oxygen. So it's like a bundle of oxygen and protein, and that's in the microscopic, of course, little molecules. And the red blood cell carries that. It transports it to healthy tissues. So normally, what it's supposed to do, it's supposed to send it to your cells. And let's say this is your heart cells. I draw these little lines because when you look at the heart cells under a microscope, each individual cell, they have little lines on them. We call them striations.
Is that for every cell or just for that?
No. This is just for skeletal muscle and cardiac muscle.
Oh, what's that? I'm sorry.
This is just for skeletal muscles and cardiac muscles. So your heart cells, the cardiac muscle cells, they contain these little lines. They're striated. So my point is this, though, man, that the red blood cell, it's transporting that hemoglobin, which is, again, oxygen, into the cells so the cells can carry out their function. What do the heart cells do?
What was that? I'm sorry.
What do the heart cells do?
The heart cells perfuse blood?
Yeah, they pump, right? So the heart cells, they pump. So that's why we need the oxygen so they can pump. If you can imagine when you're running, why is it that you get tired when you become physically active? Because your muscles need more oxygen. And if you're not breathing right, or if you're not in good condition, your heart cells or your muscle cells or all your body cells, they're not receiving any oxygen. That's why you feel that fatigue. That's why you feel that tired. That's why you feel that you're out of breath. Does that make sense?
Correct.
So when somebody has angina, which is, again, chest pain, you need to know that angina means chest pain, okay?
Okay.
This is caused by ischemia, lack of oxygen to the heart muscle.
What was that one more time?
When we have ischemia, can you hear me okay, man?
Yeah. I hear you perfectly. It's just me.
Okay, no worries. So when we have ischemia, that's a lack of oxygen to the heart muscles, to the heart cells, to the heart tissues. That's what's happening. And that's why people get chest pain when they're going to have a heart attack.
So ischemia is just
a lack of oxygen.
Well, I'm sorry, go ahead.
Yeah, lack of oxygen in tissues.
But it's not in the heart or just tissue specifically?
Tissues in general.
Okay.
Yeah. So what I was trying to do is this. I was trying to explain this word angina, right? Angina
is chest pain.
It's chest pain, which is caused by
ischemia.
Yeah, caused by ischemia to the heart cells. So ischemia is lack of oxygen to the tissues. Angina is ischemia at the heart cells.
Wait, give me a minute, please. Let me just get another pen, please.
Yes, sir. Sorry, I had paused it for a while. So again, angina means ischemia to the heart cells, lack of oxygen to the heart cells. And that's what causes the chest pain. And the chest pain is brought about these blood vessels, the coronary arteries that are showing you right here. This is what they're supposed to look like. The blood's supposed to pass on through. But you see how the yellow plaque is limiting the space inside the blood vessel. That means it's making it more constricted. It's reducing its patency. Patency
So
means
it's taking a little more extra to like pump the blood, right? Or
that
pump the
is
oxygen.
correct. Yeah, that's correct. And that's what you were saying right now that, oh, they require surgery. That is correct. So a patient that has angina, they have this issue. Something's wrong with the coronary arteries. Something's obstructing or interfering with the patency. Patency means opening. And you need to know that word as well. So patency means
Which
open.
word?
Patency. Can you see down here the one I'm drawing?
Yeah.
Okay, cool. So patency means opening. So the coronary artery should be patent, which means what?
It's open.
Yeah, so the blood can get to the heart cells, so we can perfuse the cardiomyocytes. This is just what we call them. Let me write it up here real quick. Cardiomyocytes. This is your heart cells. Myo is muscle.
So
Cytes is cells.
what does that for though?
What does what stand for?
What does that mean? Like cardio? That word you just wrote down.
Yeah, cardio is heart, muscle, cells.
Wait.
So heart, muscle, cells. Cardio means heart, myo means muscle, cytes means cells.
So cardio means heart.
Yes.
Myo
Sorry.
means what?
Myo. Muscles. Can you see it or no, bro? Are you doing this on your phone or on laptop?
No. I can see. I'm just repeating it.
Okay, cool.
My bad. I'm sorry.
No. You're good. That's good. Keep repeating it. I'm sorry. I just thought you couldn't see it.
Muscle and then cytus means cell, right?
Cytes. Yes. Cell.
Okay.